Hey, this is Leslie Schmidt. I've got a patient here that I'm going to simulate CPR on, and I have watched the instructional video, so we'll go ahead and get started with this patient. The first thing you're going to want to do whenever you have an animal that needs CPR is lay them down on a firm surface in right lateral recumbency. What I'm going to do is I'm going to now assess the patient to make sure that they're indeed not breathing. I don't see any chest movement. I'm going to listen with my stethoscope. Don't hear anything. I have blue cyanotic membranes. I'm going to go ahead and palpate for a femoral pulse to also ascertain whether there's no cardiac function, and indeed there's no respiratory or cardiac function, so this animal does need CPR. We're going to do a couple things when we give an animal CPR. We need to clear their airways, so we're going to make sure we're going to lift the neck up and extend it, make sure we don't see anything down, and we have a patent airway. I don't have any little pieces of foreign matter in there or a lot of phlegm or foam. If I did, I would wipe that out. I'm going to come to the chest really quickly and flex the elbow back, and the point where the elbow touches the chest would be where I'm going to do my compression. So I've already gauged those two things. I have an open patent airway, and I know where to start my compression's at. So what I'm going to do is go ahead and cup my hands around her snout. I'm not going to cover her nares, but I'm just going to hold her mouth shut. I'm going to put my mouth over her nose and mouth and give her 2 breaths. When I gave her breaths, I gave it enough pressure to inflate her lungs, but not overinflate her lungs. I just want to see her chest rise to a normal level. So I'm going to go ahead and start my chest compressions. With this animal, she's small enough to where I can use my fingers to, pump the heart. If she were bigger, I would go ahead and use the back of my hand on her chest and push it down to the table. If she were a medium to large size dog, I would do that. So we're going to go ahead. I've given her 2 rescue breaths. We're going to start our chest compressions. I'm going to do 2 breaths for every 30 chest compressions, so we'll go ahead and start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, now I'm going to go ahead and assess to see if my efforts have been successful. I'm going to feel for a femoral pulse. I'm going to watch the chest to see if it's rising on its own yet. It's not, so I'm going to go ahead and perform another 2 breaths with 30 compressions. So my mouth is going to go over the mouth and the nose. I'm going to go ahead with my compressions again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'll go ahead and assess for a femoral pulse again. And at this point, if I had restored circulation, if I had a heartbeat and the animal started breathing on its own, I would stop CPR. But if we don't, we go ahead and continue giving the 2 breaths for 30 chest compressions in order to restore cardiac function to our patient. Thank you.